Hello, my name is Dr. Denise Black, and I'm a gynecologist in Winnipeg. It has been my honor and pleasure to work in women's health for the last 3 decades. In the next 5 minutes or so, you will get 5 practice pearls to effectively choose oral iron therapies. Pearl number 1, iron deficiency is a common clinical problem. Anemia in Canada is quite common. About 4% of women and 2% of men are anemic. Half of this is due to iron deficiency. 20% of reproductive-age women and 50% of pregnant women are iron deficient. 9% of women aged 20 to 49 have insufficient iron. 13% of teen women have iron insufficiency, and 3% of adult males are iron deficient. There are 2 types of risk factors for iron deficiency: physiological and pathological risks. Physiological risks include infancy, adolescence in females, pregnancy, blood donation, elite athletes, and those on restrictive diets such as vegan and vegetarian diets. Pathological risks include blood loss, which may be ongoing gynecologic or GI losses or recent surgery, malabsorption, and iron deficiency associated with chronic diseases such as cancer, chronic kidney disease, rheumatoid arthritis, and inflammatory bowel disease. Sometimes physiological and pathological risks coexist. Pearl number 2, signs, symptoms, and diagnosis of iron deficiency. Common symptoms include fatigue, cold intolerance, headaches, irritability, depression, and pica, which often manifests as ice craving. Signs of iron deficiency include nail changes, especially spoon-shaped nails, angular cheilitis, and hair loss. Routine iron deficiency screening for the general population is not recommended. Instead, a case-based risk factor identification approach is preferred. Those at either physiological or pathological risk should be screened. Initial laboratory testing should be done via a complete blood count and a serum ferritin. The hemoglobin levels will identify anemia, but the diagnostic test of choice for iron deficiency is serum ferritin. The WHO classification of iron deficiency anemia is hemoglobin levels in males less than 130 grams per liter, hemoglobin levels in females less than 120 grams per liter, and hemoglobin levels in pregnant females less than 110 grams per liter. Iron deficiency is ferritin levels below 15 micrograms per liter, and iron insufficiency is ferritin levels between 15 and 30 micrograms per liter. Pearl number 3, first-line therapy. Oral iron is considered first-line therapy. Absorption of most oral iron therapies is poor at less than 10%. The unabsorbed residual iron in the lumen of the intestines appears to be the main cause of GI side effects from oral iron therapies. Due to mainly GI side effects, about 1/2 of all patients will stop taking oral iron therapies. Here is a table looking at commonly prescribed iron supplements. Note the amount of iron absorbed and the amount left in the lumen for the various preparations. Supplements made from animal sources tend to be better absorbed than those from other sources, and vitamin C facilitates absorption. Pearl number 4, the advantages of Ferrous Ascorbate. Many of you will be familiar with some of the iron therapies viewed previously, but most will not have heard of Ferrous Ascorbate. It is a combination of ferrous iron and ascorbate together in a single molecule. Ferrous Ascorbate provides highly absorbable iron by a few mechanisms. Ascorbate, which is better known as vitamin C, forms a soluble complex with iron in the stomach, which remains intact even in the intestine's alkaline environment, thus facilitating absorption. Ascorbate increases non-heme iron absorption by preventing the conversion of absorbable ferrous to non-absorbable ferric iron. EBM Fer is the brand of the ferrous ascorbate available in Canada. It is gelatin-free and contains no animal products, so is suitable for vegan and vegetarian diets. It is Health Canada approved for iron deficiency anemia, including use in pregnancy. It is manufactured in North America under strict good manufacturing processes. It provides effective oral iron therapy due to high bioavailability while leaving less unabsorbed iron in the GI tract. It provides 100 milligrams of elemental iron per capsule and is recommended once daily with food. Pearl 5, what to expect and how to monitor response to therapy. Well, the goal is to correct anemia and replenish iron stores, aiming for a ferritin level of about 100 micrograms per liter. What can you reasonably expect with oral iron therapy? You should see increased reticulocytes in 7 to 14 days. When reassessed at 2 to 4 weeks, hemoglobin levels should increase by 10 grams per liter at 2 weeks and 20 grams per liter by 4 weeks. If hemoglobin or ferritin levels are not rising as expected, consider adherence, ongoing losses, malabsorption, or perhaps an alternate diagnosis. Thank you for your time and attention. To improve your experience with future videos, please share your feedback.